And county governments have been put on high alert following the outbreak of the coronavirus that is fast spreading outside China. Health CS Mutahi Kagwe says the Mbagathi isolation facility will be ready tomorrow with training of medical personnel ongoing in Machakos and Naivasha. Kenya is yet to record any infections, with a German couple isolated in Mombasa testing negative. And as our very own Raquel Muigai reports, the World Bank has set aside some $12 billion for developing countries to assist in emergency response.
When 6 African nations register positive coronavirus results, Kenya is justified to be worried. Algeria has registered 8, Egypt and Senegal 2 cases each, with Morocco, Tunisia and Nigeria having only 1 case each. A situation that necessitated an urgent meeting between the National Emergency Response Committee on Coronavirus and the Committee of Health for the Council of Governors, as well as all 47 CCs for health, to address issues of preparedness at the county level.
The counties also must establish immediate isolation and quarantine facility.
Even the chiefs and sub-chiefs are part of the process that we are going to use. Even the police, themselves must be ready in any eventuality of how to isolate and to secure, certain areas.
Each county will have an emergency response committee that will be chaired by the governor, with the county commissioner being the co-chair. 2 days being the deadline given to the counties by the Ministry of Health to come up with a budget. A budget that will be boosted by the World Bank, which offered $12 billion to developing countries to strengthen health systems in case of the eventuality.
The Treasury has released money to work on Mbagathi and so on. So it is not just depending on donors. On this one, first we are depending on ourselves and getting extra support.
All level 5 and referral hospitals are to be used as special facilities to treat and isolate infected persons, with CS Mutahi Kagwe indicating that Mbagathi Hospital will be up and running by Thursday. But even as the national and county governments emphasize on their preparedness, a section of health professionals are still worried.
The clinical officers have among the largest number in the JKIA, and they are not trained. They were called and posted to JKIA to screen coronavirus.
As we speak, there is training going on in Naivasha. There is training going on in Machakos, and we are going to roll out a training program for our health workers so that we can protect them. We also want them to know how to use the gear, because some of them have not been using this gear. They have never used it.
With new positive cases being reported worldwide daily, Kenyans have been urged to abstain from spreading false information as well as discriminating Asian nationals in the country.
This rumor mill and false information is that it will make it difficult for people to believe the truth if something were to ever happen.
So far, no person has tested positive for coronavirus in the country, with the ministry having already rolled out public awareness programs on local vernacular stations. Raquel Muigai, Citizen TV.